Thank you, Dwayne. I've got 2 o'clock here on my clock, so I will, for the listening audience, say who we have on the call. We have our voting members of the Health Board, myself, Amy Leone. We have Mayor Nathan Johnson. We also have Dr. Mary Milroy. Our ex officios who are here helping us make decisions are Ross Denherter, our city attorney, Jason Foote, commander and police department, Brad Beast, community development manager, and Dave Mingo, who is our community development director. So good afternoon, everybody. We kind of have a bigger agenda, so I'll just jump in right away. I'd like to talk a little bit about the city election first. The commission moved our election to coincide with the county election June 2nd. Since that time, the governor has worked with the legislature. They have allowed cities to move their election any Tuesday in June.
Did anybody else lose Amy?
Made the record.
Hey, Amy, we haven't heard you for about the last 30 seconds.
This election, this election, that we moved city election, county election. Yeah.
I did send her a text to try and see if she can move closer to Wi-Fi. She's saying she's going to call in.
Okay.
I know there's a couple places in my house, if I end up on the wrong side of the heat vent or something, it definitely disrupts the signal substantially.
Hello.
Hey, Amy.
Hi, Amy.
Sorry, can you all hear me?
Yes.
Much better.
Okay, I'm sorry, I called in. I think I must have a issue with the internet connection here. So, pardon me to everyone about that. I wanted to talk first about the city election. So the commission moved our election to June 2nd, which at the time I felt was good enough in terms of the distance and time we would need between the onset of COVID-19 and when we'd be over our peak. And I think since that time, we've learned that that probably isn't enough time. So I wanted to get feedback from all of you as to whether or not we should try to continue with that date or we should try to work on something else, either through Ross or another channel.
So I guess a couple questions. When would absentee ballot
voting begin? And then Ross, there's been a lot of talk in the country about mail-in voting. If the city wanted to do that on its own, do we have any latitude to implement a system like that?
Unfortunately, Mayor, I don't know that off the top of my head. I'd have to do a little bit of digging, but I would expect I can get you an answer to that question fairly quickly.
I know they do that just across the river from us in Nebraska, and it seems to work well. So that would be a great solution to keep democracy going during this.
If there's a way, I'll certainly make sure you're aware of it.
Absentee voting begins May 18th. So I know we're a little advanced here, but really that's not a lot of time. The county did agree to having our election with them on June 2nd. So that's part of what I'd want to communicate too. If there was something else we could do, or we want to move it to the end of June or something different, those are all considerations.
Well, I think we have some time to figure it out. That's like a month away before absentee voting would start. So let's just take a couple weeks to see how things evolve and see if anything changes. That would be my opinion.
Okay, I think we should maybe still have Ross do a little research on mail-in voting, if that's even something that's in the realm of possibility, as well as looking at if it can be moved away from June at all.
Will do.
Okay, then for the next item, Todd Larson and I have talked about the fountains, drinking fountains in the parks, as well as the splash pad down by Memorial Park, Riverside Park, and our fountains that are just visual fountains, like our fountain at Riverside Park and the Meridian Square Plaza and Westside Park, and we have one on 4th Street. My feeling was if people are using these appropriately, then there's not a health issue. But I wanted to have that discussion with all of you. The fountains that are used for visual enjoyment, I think that's more of a matter of social distancing and maintenance than it is a health concern, but wanted to talk about all those things with you. So thoughts about health concerns surrounding those items.
I guess I don't know anything specific, but when I hear drinking fountains, I do have a little concern. I know kids and stuff sometimes put their mouths right on the drinking fountain. I guess I would have a little concern, although that's just, I've never read anything. I honestly don't know, other than when I first hear that, I have some concern. As far as more like the visual fountains and things, I think as long as we're keeping the parks open and people are being respectful about the safe distancing and things, I guess just hearing about it, I don't have a concern about that. Even the splash pads, I guess that seems okay. It's mainly the drinking fountain. I might have just a little concern if people were it's almost like sharing, I don't know, but that's just maybe my first impression, that's all.
I think, for the visual fountains that are more or less for aesthetics, maybe a nature of if we believe we're going to have the staff to maintain them, because they do take a considerable amount of maintenance throughout the summer. Splash pad would just be a matter of social distancing, and if we get a really warm day and the splash pad is operating, are we encouraging a lot of folks to come around there. I don't know, but again, that's my first impression too, that it would be something safe to use. But water fountains, we will be turning on the water in the parks, meaning our restrooms, when nighttime temperatures are warm enough to allow for that. And that could be, gosh, with the weekend weather we're going to have this weekend, that could still be a while away. So maybe that's something we just want to consider and try to find a little information on about drinking fountains.
So as far as the decorative fountains, or if we had any concern at all about those, becoming a gathering place, which would be our objective, plus the staffing issue, is that something we could maybe just watch and see how staffing goes for a couple weeks also, even beyond where we might otherwise start them with the frost issues? So if we were going to start them at the beginning of May, could we wait into the middle to the end of May just to kind of get a better read on how we're going to end up staffing, as we're on the uphill end of the curve still?
Yeah, for sure. I can talk with Todd about, typically they try to fill them in mid to late April. I can talk to him about, holding off on that. And then I believe we can still turn the water on in the restrooms and the sinks in our parks without turning on the drinking fountains. So until we have more information about that. Same with the splash pad. I think the splash pad can be turned on or off, depending. So that isn't necessarily something we would have to decide today. But I also do see people using the splash pad, since it isn't very big, sort of independently as small family units too. So I think we have some time. It's just something maybe to lift up, and I can get more information from Todd and we can think about and maybe try to get some direction as time goes on to him. Anything else on those items? If not, I'd like to talk about the document that Ross drafted for us to bring forward to the City Commission on Monday. I've shared the draft with the Commission and have not heard anything other than support to have the Commission issue this type of advisory. Ross, do you want to walk us through the document a little bit?
Yeah, I sure can. This document was modeled after the mayor's proclamation from Sioux Falls, and it contains what I'd call strong advisory directives by the City Commission, which does not have necessarily the force and effect of law, but provides very good guidance for the community to follow to protect each other and ourselves from the coronavirus. The first, section 1, is a directive for our residents to stay home and only go out for purposes of being in the outdoors for emotional well-being purposes, but isolated from other people, as well as only going out to conduct business for essential commodities and services. So there is a list of about 7 items that we are instructing the public to adhere to. That includes residents shall limit visits to grocery and retail stores to once per week or use delivery or pickup services. When necessary for residents to visit grocery and or retail stores, households shall choose a designated shopper to do the shopping for the entire household in order to reduce the number of people in the stores, with the idea being that you won't have a mother with a couple of children, things of that nature. Shoppers shall remember to remain at least 6 feet away from others in the store. And whenever possible, residents shall avoid taking any children still living at home with them on any essential shopping trips. Residents returning from extended trips or spending the winter in warmer climates shall self-quarantine for 14 days upon their return, in case they brought any unwelcome guests back with them. And residents should support local businesses that promote social distancing and demonstrate compliance with CDC guidelines. That would be encouraging our local residents to support the local economy by buying carry-out food items, delivery food items, things of that nature. Residents are encouraged to participate in organized religious activities only via remote or drive-in options or drive-through options as available. And even while adhering to the 10-person gathering limitations imposed by the ordinance the commission passed, residents are directed not to participate in voluntary in-person gatherings of any size outside of their immediate households. So this is a directive to the community to effectively function as though we have a stay in place or shelter in place directive from the governor without actually imposing a new ordinance or new regulatory structure upon the community. The next portion of this talks about the way residents should interact with healthcare providers. Our residents are still encouraged to look after their own health, meaning we're encouraging them to still attend routine medical appointments, but follow the guidance of medical providers and always call ahead of feeling sick. And residents may continue to go to the pharmacy to pick up medications, but we are directing residents to use drive-through or delivery services whenever that is available. We are also directing our residents to follow safe practices recommended by the CDC and the state. I'll just read what it says here. Residents of the city of Yankton shall continue to practice good respiratory hygiene, cover coughs and sneezes with a tissue or use the inside of their elbow, wash hands often, disinfect surfaces frequently, avoid touching their face, and strictly adhere to social distancing guidelines. And this is the new stuff. Additionally, consistent with current CDC guidance, residents over the age of 2 who do not have trouble breathing should wear face coverings, for instance, a face mask entirely covering the mouth and nose, when they are in public areas outside of their homes, such as, by way of example and not limitation, the grocery store or the medical clinic. Such coverings shall not be used as a substitute for social distancing, which is vital for slowing down the spread of COVID-19. So this is new. We are directing our residents to use facial coverings when they are out and about. We are also talking to our citizens about taking care of their own mental and emotional health. So to that end, we are encouraging our residents to engage in outdoor activities such as walking, hiking, running, or biking, provided that individuals strictly comply with social distancing and all other measures as advised by the CDC. Residents should be good neighbors to those around them and help others if available, keeping in mind that it remains critical to use safe practices as recommended by the CDC. And residents should support local businesses to the greatest extent possible while strictly abiding by CDC guidelines and this resolution. So essentially, if you are out and about and following our advice to support local businesses that have safe practices, you still need to be mindful of others and stay away to the best extent possible. And then lastly, we have an advisory to businesses that are not required to close or businesses that are not otherwise bound by the 10-person gathering limitations that we have set forth in our ordinance. Whenever it is possible, our businesses should limit the patron occupancy to no more than 20% of their posted occupancy and shall institute and enforce a safe social distancing strategy for patrons inside the place of business and for patrons that may be waiting to enter outside the place of business. So if we are limiting those who can enter and there's a line, we are also encouraging those business owners to be thinking about how that queue system is going to work outside so that people don't get within dangerous distances of each other potentially. So that's the summary of the document that I have drafted. the language is written sternly in terms of shalls and you are directed and so forth. But this is advisory or educational in nature. There's no criminal penalty for failure to follow these rules. But I think that the public is willing, as has been demonstrated to date, to follow the directives from the city. So I think this is an appropriate place to start.
Thanks, Ross. Could you just unpack the one statement about the 20% occupancy a little bit more, maybe giving an example of what are you talking about, for example, in a grocery store, or if you could give some examples and break that down, that'd be helpful, I think.
Okay, I think the best and easiest example that we can all see right now is Walmart, and I understand this isn't just local, this was company-wide, has implemented their own independent strategy where they are limiting the number of patrons that can be inside the store based on their own posted occupancy. And if that number has been reached, you queue outside before you go in. So there are fewer people bumping elbows with each other inside the place of business. So that strategy is a good strategy, and we are encouraging other businesses that do not have an obligation to close to implement a similar strategy to prevent as many patrons as possible from being in very close contact with each other.
Gotcha, thank you. And we have made a few tweaks, Health Board, in language since the first version you received. It hasn't been anything major, just a couple of housekeeping things. We've changed it from a proclamation to an advisory, for example, to bring more seriousness to what we would ask the commission to act on Monday. So I would just ask for people's comments, thoughts, edits to this document if necessary.
I think this is great in that, there are a lot of people who take this seriously, but there are those who don't. But the people that do, this empowers them to use peer pressure, which I think we've been seeing a lot in the community based on the feedback we've gotten on our ordinance and people watching what others are doing. The one area I have questions about is, I continue to hear some concerns, especially about the manufacturing sector, and that there may be some lack of social distancing enablement there. Is there anything we could work into this about those types of businesses, knowing that they are essential and we, according to federal guidelines, they need to keep operating, but to encourage them again through education to enable their employees to practice social distancing as much as possible.
Ross, would they be included in that last statement of businesses?
Yes, absolutely they would. And I think the key language is that they need to implement and enforce or institute and enforce a safe social distancing strategy. I could change the word patrons to patrons and employees. I could add to it, but I would not view them as being exempt from this. They are potentially creating an equally dangerous situation for their employees. I think we have all of them, the members of this board, have heard about what happened up at the packing plant in Sioux Falls, with potentially as many as 120 employees in one facility having all shared the virus amongst each other. And I hope that was a wake-up call, and that our local manufacturing facilities will address their own operations accordingly to prevent that from happening, because that effectively shuts down the entire facility.
Yeah, I think the broadening of the language there would be helpful, because I saw patrons and right away I think retail stores. So that's a great idea, Ross. Thanks.
Yeah, I think that clarifies it, because I would like to put some strong language behind the fact that the employers are responsible for maintaining safety for their employees too. So I like that addition. I think overall it gives clear direction to to the community about what is being expected. So I think that'll be very helpful.
The only
I
other
think-
thing,
Go ahead, Dave.
the only other thing that Brad and I discussed in the little educational piece where this was summarized, was to put some language in here that discusses when people are basically out in their own yard. So we had a couple of little language tweaks that kind of address that, and we can sure send that around to the board. I know Brad is efforting right now to try and find that language.
So I can't find exactly what you and I had exchanged, but in the end, in kind of the educational piece, we settled on simpler language, I think, than you had, Ross, where you provide some examples away from home. I wonder if simplifying it to wearing a face covering in public settings per CDC recommendations or something referencing their recommendations rather than being really specific about away from home. I don't know if the home really applies. Maybe just sticking with, wearing the face covering according to CDC recommendations might be simpler. And then if and when and as the CDC changes its recommendations, then that just matches with what they're telling folks.
Okay, so under safe practices, that's section 3, we're just talking about residents over the age of 2 who do not have trouble breathing should wear face coverings in accordance with CDC recommendations.
Yeah, I'm not sure the examples. I mean, I think right there it might just be because there's a lot of education out there and we're sharing the CDC stuff. Because I think you might be able to read that in such a way that says, I mean, I know you say such as and by example and not limited by, which is a little lawyerly, admittedly. Maybe just simpler is better.
Okay. I do still like the phrase when they are in public areas. Is that okay? Well, maybe you could still be gathering with people in your yard. And we'd still want people to be using masks if they're interacting. So maybe yeah.
And again, according to the CDC's recommendations, I think, I don't know that you would want to create a situation where folks were either scared to go outside to walk around their house without a mask on, which might be if I walk out of my house, am I in a public area? And are we saying that if I walk out to look at my daffodils, I have to wear a mask? That's not really, I think, what we're trying to say.
No,
my daffodils are blooming, by the way.
I was just thinking about, one of the things that I've seen on Facebook is these yard parties where you'll have maybe 6-8 people who are all sitting in lawn chairs 7-8 feet away from each other in a great big circle, all having an adult beverage, which looks like a great deal of fun on a nice day. But in that setting, it's probably still a good idea to use a mask because we're interacting with people outside our normal household circles.
I'm going to ask the good doctor on that. Would that be accurate? That you should be doing that, Dr. Milroy?
I don't know if I've actually seen anything specifically saying that. And I guess in that situation, are we asking people to mask in the parks if they're staying 6 feet away? So I guess I would think that as long as you keep that distancing in your yard, you probably are still kind of living by the letter of the rule. I don't know if I've actually seen that addressed specifically. So, that if you get a big crowd of, 7, 8, 9, you're kind of coming close to the 10. And I guess I don't know for sure. But I guess if we try not to give a lot of examples and just, say, when interacting with others outside your home is a little less specific and would cover lots of situations.
What I've read has been what, when you're in public. So that's kind of I'm sure that's a catch-all, a little bit of a catch-all phrase there.
Right, and I do, and maybe there's some benefit to the interaction thing, or maybe using that terminology, because I've also heard other folks say, we have people driving alone in their cars with masks on, which really, it's not serving a real purpose. I mean, maybe they just forgot to take their masks off, or they like to leave them on. But I mean, maybe giving the impression that when you leave your home, you should immediately place a mask on and remain masked until you return to your own home isn't really what the CDC is saying either.
I kind of like the term interacting with others, because honestly, if you're going out to look at your daffodils, I don't think you need a mask. If you are driving alone in your car, I don't think you need a mask. But whenever you're interacting with people that are not your immediate family within your home, it should be a consideration to put on a mask. And so in that situation, I think that being safe is best. So whenever you interact with others outside of your home, that you should.
Yeah, that makes sense.
And just so the board knows, the city commission is going to get the version, the most current version. As Ross makes these changes, we'll get them, any changes that we have today, we'll get them to them probably either tomorrow morning or tomorrow afternoon, so they can see them, and of course we'll ask them to act on your recommendations. But we did put their package together already.
You're muted, Ross.
Thanks, Brad. Can I read back what I have on this sentence just to make sure I've kind of captured the spirit of what we've discussed here? So it now reads, additionally, consistent with current CDC guidance, residents over the age of 2 who do not have trouble breathing should wear face coverings, i.e. a face mask entirely covering the mouth and nose, when interacting with others not within your household, according to CDC recommendations. Is that better?
I agree.
Yeah, and that'll cover the whole, somebody wants to look at their daffodils question in their yard too. So
Very
I
good.
like that.
Overall, Ross, very well written. I think this is a really good thing to move forward with the community. And so the people listening and the rest of the health board knows, we're working on a public education piece if the commission passes this, to help communicate the spirit of this to the public, and that will be provided both in English and Spanish. Dr. Milroy sent us a letter to the editor article that she has put together, which I thought was very well written, and I think we can give her the nod to go ahead and send out to the public just to continue to hammer home that education. That's another one of the recommendations that I've planned to share with the city commission is we all have to do a really great job and do everything we can to over communicate and over educate to the public the importance of doing these things. I do have a commitment from Wayne Kindle that he is going to reach out to teachers as well to get these types of practices known throughout the school-age children and their curriculum. So he's going to talk with teachers about ways to do that. And I also know we're working with some private folks who could help us do some social media education and communication to sort of stir that conversation community-wide.
Yeah, I received some comments back, and so I'm making some not huge changes, but some changes in that, and I can send it out to everyone. And if that's good, I'll go ahead and send it into the P&D and the Observer. And then I did get a message from Brad about recording that, and I agree, probably doing it without a in-person, violating our own rules is actually a good idea. And so looking at times, Monday morning, all day Tuesday, whatever really works, I can be pretty flexible.
Sounds good, Dr. Milroy. I'll send some stuff out there. Just trying to be a stickler to our own recommendations.
That's a good catch. I liked it. So.
Dr. Milroy, I was speaking with KYNT today too, and they said they'd be happy to host you for an interview via phone, of course. So if you reach out to them, they can arrange that.
Okay, perfect. I shall do.
Boy, we're going to have to put Dr. Milroy on the city payroll here pretty soon. She's doing a lot for us. I do have a couple of other things that I would like to talk about. One is something that Ross and Dwayne Johnson, our IT director, as well as Nathan and I have discussed, and that's to recommend to the City Commission that they temporarily suspend our physical meeting location for our City Commission meetings. We have the authority now from the state to not have a physical meeting as long as we provide an opportunity for people to participate online or over the telephone, which we have that. So nothing will change for people that are watching on the YouTube channel or participating that way. We just would not have a physical location where people could come. And that, again, is just being consistent with practicing what we're preaching and not, telling people stay home and don't go out if possible, but come to the City Commission meeting. So I just thought that would be another way we can reinforce a good practice. So thoughts or comments on recommending that to the city?
Again, I think that's following our own rules, so that makes sense.
Awesome. Okay, yes, we do like to try to follow our own rules and have them apply to us. So I've had a couple other things that I want to lift up to the group. And I know we have people that are listening that are interested in hearing more about our ordinance that the City Commission enacted and we recommended to them. Specific items that have been brought to my attention have been tanning studios and a request as to whether or not those could be reconsidered for reopening. Hair stylists. Now, I haven't specifically heard salons in general, but I have heard hairstylists. So maybe thinking about both of those too, if it's time to reopen or become more relaxed on that ordinance, if that's something we'd recommend to the City Commission. Also, I think I heard one other one. Gosh, and I have to go back in my notes now to find that one. But any thoughts on tanning salons or hairstylists/salons?
Well, Amy, was the third one dog groomers?
Oh, yes. The other one was pet grooming again, and I know we talked about that again last time. So maybe that's why it didn't come up to, but that was the third.
I guess what I'm thinking is that while our numbers are still increasing, my thought is that, and we're trying to be very clear about essential services and masking. I guess right now I wouldn't include that in food, pharmacies, things like that. So at this time, I think especially with our, we'll revisit it if our numbers start to go down. But right now, as long as numbers are going up, and we're trying to make actually make an advisory that's even stronger about trying to stay home as much as possible. I guess I would not classify that as an essential service, and really that is what we're asking people to do. So I think right now I would stay where we are.
I would agree with you on that, Dr. Milroy. I was on a conference call with the governor today with other mayors across the state, and she said, we haven't seen the number of infections that early models suggested we might see, and the reason she believes that is the case is because of the social distancing measures we've implemented. And so then the danger of that is the public sees, well, these numbers aren't as big as we were told, so why can't we just go back to life as normal? Well, if you do that, then we'll start to see the rise in numbers we were worried about. So it's really a hard thing to wrap your head around. And everything we know about the virus so far is that we are still in the danger zone. We've seen how it explodes in other cities. Reports are in rural areas, it's been spreading at a very fast pace. Although the raw numbers aren't as large, and some of that I think is because in rural areas they maybe aren't taking social distancing as seriously, or measures haven't been implemented. They also maybe have more vulnerable population there. So whatever the reason is, I think it's still important that we practice and encourage, and in some cases mandate, social distancing. And I think we're on a good track.
Any other advice from ex officios? You guys have been kind of quiet today.
We had some sirens going by City Hall, so I didn't want to turn my microphone on while the sirens were very loud. No, I agree. I mean, especially in light of, we're taking the next step to provide an actual advisory in the form of a resolution. It just seems a little contradictory to then all of a sudden remove things from the contents of the ordinance at the same time you're adding something as far as strengthening of statement in the form of an advisory.
I think we've warned people from the beginning, and it's not just us. This is what the national and international figures say as well. If we do this right, it's going to look like we overreacted. But if we do it wrong, the outcomes will be really bad. And we'll see, exploding cases like they saw in Italy and Spain and even in New York and Washington. And I don't want to end up in that situation and look back and think, wow, the evidence was there on what we should do, but we were under some pressure because of the pain that people are going through regarding economic issues, and we didn't put public health first. And I'm just really strongly an advocate that public health is our number one priority right now.
Yeah, I would mention too, if it's valuable. I don't want anyone to think that this is about sanitation. My experience with our facilities that are, I guess, sort of glam squad type facilities, hairdressers, nail salons, tanning salon, all those things that feel so good for us and we all enjoy, are impeccably clean, and they use great sanitation and practices all the time, not just now, and not just in this situation. So it isn't really about them not being careful. It's just a matter of doing everything we can to slow down that spread. I do hope that there's some opportunity for purchasing, gift cards or gift certificates or chamber bucks, things like that can be used in the future for people when we do get to a point. My understanding is this is just the early days, however, and it will be. I'd like to see those numbers stay down for a long period of time before we look at opening up that ordinance and picking it apart as to what we're comfortable opening again. And with that said, soon I'll be working with a team of staff members on what that reopening plan might look like when we're ready for it. We want to put a lot of careful thought into that, of course, and have a lot of expert advice on that, but I'm not near ready to recommend that at this point.
Amy, I think one of the benefits too of having some time to understand what other folks are experiencing in places in the country that are ahead of us in this endeavor means there are people having this conversation across the country. And I think that during this time period, and I'm hopeful during this time period, we've seen professional organizations across the country and trade and industry groups start to study their own industries and understand how this is going to look for them. And I think we'll be the beneficiaries of those things, those sort of guidance and materials, and public health folks weighing in on it in places that are a bit ahead of us. And I'm happy to stay behind where other folks are. I'm not interested in catching up on the curve they're on. But I think that will be helpful to us in understanding what other folks are seeing as best practices.
Thank you for saying that, Brad. I also think we have some examples here in our state. Maybe too early to say. I'm not a statistician by any stretch of the imagination, but you know, Beetle County was very quick to move forward with an ordinance, very quick to move forward with sort of keeping things in place and social distancing. They've been very proactive. As of today, you know, they still have the 21 positive cases. They have 19 recovered. Their recoveries are going up and their cases are not. Now, I'm not saying that's completely an indicator of what's to come for them. I hope it is. But I feel like that's a little bit of data that I'm really watching that might be telling me, hey, this is the right direction.
I think the rest of you are probably like me, and you're looking for news about how we get out of this. And there have been some organizations that have put together plans for how the United States starts to move out of these lockdowns. And I think the real common theme I'm seeing is that until we have widespread rapid testing, we're really at the mercy of the virus, and we are nowhere near widespread rapid testing at this point. And there are political reasons for that, I believe, but we won't get into them here. And so, you know, absent of that, until we get a therapeutic drug that can potentially lessen the impact of the virus on people, I think this is life. And the governor reinforced that on our call today, that, you know, unless something drastically changes, expect this till at least June.
Yeah, I'm very hopeful that with the ordinance, with the, you know, and I think we have a good community in a lot of community spirit, that people are really doing their best to follow this. And I think, you know, hopefully we'll see the benefit of that and not have some of the disastrous situation that other places saw. So if we can avert those kind of really bad situations, it will be, as tough as this was, we'll be glad we did it.
Okay, well, I don't think we have any different recommendations then for the city commission in regards to their ordinance. Is there any other business that any member or ex officio would like to bring forward for the group?
I had kind of a quick question. You know, we talked a little bit about maybe some signage or some reminder at maybe the playground equipment. I've been driving around a little bit, and it seems like I've seen that better now. I haven't seen the groups that were there. I've had a couple of people reach out to me with concerns about kind of groups on the Meridian Bridge. And I just was wondering if there is going to be some signage or reminders. Maybe one at the bridge might be a good idea too. I had several people reach out to me with concerns about that.
Okay, thank you. I did talk with Todd Larson, our Parks and Rec director, about signage. I did not mention the Meridian Bridge, so we can certainly look at some kind of, we'll figure out how we can sign that. We do have some information on social media on the Parks and Rec site, but physical signage, I know we talked about at the parks, but I did not mention the bridge. So I will certainly do that. The weather for that is working in our favor. As it stays cool, people are less interested in, you know, coming to parks and playgrounds. But soon, when we do have warm temperatures, I think it will be an issue again. And so it'll be nice to have the reminders up for people.
My only question would be is, do the voting members of the board want formal action on record regarding the advisory.
Oh, thank you, Dave. That would probably be the right process, since that's what we used in the past. So let's take some action on that. Do one of the voting members want to make a motion to recommend to the City Commission that they pass the advisory as recommended and amended by the Health Board?
I'll make that motion.
And I will second it.
All in favor, let's signify by saying aye. Aye. Opposed, same sign. Okay, thank you. That motion passes. I'll make that recommendation on Monday night to the commission. And thank you, Dave, for bringing that up. Brad or Jason or Ross, do you have anything for the group?
We also probably want an official recommendation from this group to temporarily suspend using a physical location for our commission meetings.
Well,
Go ahead, Amy.
I'll make that motion to temporarily suspend the official meeting location.
And I'll second it.
Okay, let's all in favor of recommending that to the City Commission signify by saying aye.
Aye.
Aye. Opposed, same sign. Okay, that motion carries. Anything else, Ross?
Not that I can think of right now, Amy. Thank you.
Jason, how are things in terms of enforcement, and what are you and your officers observing just in general in the community?
So again, since the last time that we met, there have not been any more complaints to the police department on the ordinance, so that's good. We did have some group of juveniles went around town last night, so got officers working on that. So there are some small groups that might be causing problems. I just like to ask the public to, just because you're in your house and not being so social, make sure you are keeping an eye on things, because there are some people that will take advantage. So just ask people to be vigilant and give us a call if they see something or need something.
Thanks, Jason. Brad, how about from your standpoint, anything that you'd like to lift up to the group?
No, thanks. Not. I think I said all my. I think I said all the things I had written down.
Okay, great. Well, I will work with Ross on making sure that our City Commission has the latest version of the advisory, and we will plan for a meeting on Tuesday again. I will get an agenda out to you all, and if it doesn't appear that we need to have, not on Tuesday, on Monday. If it appears we don't need a meeting on Monday, we can talk about that as well, but for now we'll keep that as scheduled. With that, I would look for a motion to adjourn.
I'll make the motion.
Second.
Okay, all in favor of adjourning today's Health Board meeting signify by saying aye.
Aye.
Aye. Opposed, same sign. Thank you very much to board members and ex officios, and we'll talk to you all Monday.
Happy Easter, everybody.
Have a
Yeah,
happy
happy
Easter.
Easter.
Nice weekend.
Take care, everybody.